This is Dr. Roger Knapp, pediatrician. I'd like to talk to you about blockage of the tear duct. The newborn, we put, of course, antibiotic drops in there, and it's real important that you try and prevent eye infections after birth. But real common to see the infants continue with a little bit of tearing and a little bit of matting up of one eye, or possibly both. And it's because the tear duct is clogged. Now, your tears are produced by a tear gland on the upper outer corner of the eye. They go across the eyeball, and you know that little bump that's inside corner of your eye? That's the entrance of this little tiny tube, and the tube only goes about a centimeter and dumps tears into your nose, and your nose absorbs those tears. Unless you're crying, you get a runny nose, those are tears coming out your nose. Well, if that's clogged, then you see a little wet, teary-eyed area in the corner, and they tend to mat up, and sometimes a little bit of mucus pretty much every time they sleep. If you have a true eye infection, then it's pus every hour, and they're a little bit swollen, and they're pretty ugly. Whereas if the first month of life they're just tearing and matting, it's a clogged tear duct. What we recommend you to do is massage the tear duct and try to open up that opening, and it's fairly effective. We give it up to, 3 or 4 or 5 months, 6 months even of age. And then if they continue, then the eye doctor will take a little tiny metal probe and probe that tear duct and open it up. And that sounds kind of cruel, but if you don't, then by 1 year of age, it's actually surgery, and you have to put them to sleep and create that tear duct. So it's important to work on this. The massaging, what you do is you don't want to what you do is put your finger in the corner of the eye, and you actually rock your finger back and forth, because we're trying to express out some mucus. So maybe 3 or 4 rocks, just 1, 2, 3 or 4 times a day. Put your finger in the corner of the eye and just rock it back, and you can actually feel that little bump going squish, squish, and you're trying to express it out. And you have to press fairly firm. Think about how hard you and I rub our eyes in the morning. Just barely touching it's not going to work. And you don't rub across, because then you just cause redness. You just rock your finger back and forth to try and express out that mucus. And if you do that 3 or 4 times a day, just 3 or 4 rocks, just real fast. Right before feeding is a good time, because then the feeding will calm them back down, because generally it pisses them off when you're rubbing their eyes. Then as soon as it's looking normal for 3 days in a row, there's no tearing and matting, then stop massaging that eye. But otherwise, keep it going. And then if it's still not there by 4 months, maybe 5 months of age, then let the pediatrician know, and they refer you into the pediatric ophthalmology doc, and they'll take care of it. If it does get infected, and there's quite a bit of pussy stuff most of the day, then it can get secondarily infected. Then get some antibiotic eye drops. But then it goes back to just the matting up only when they sleep. And then you can stop the antibiotic drops at that time. So it's really not as much as eye infection as it is a blocked tear duct. I hope that helps you. Thank you. This is Dr. Roger Knapp.